afternoon, ladies and gentlemen, and welcome to Let's Chat with Dr. Celeste, MD. I'm your host, Dr. Celeste Reese-Willis. I'm your board-certified family medicine physician specializing in urgent care. I assist busy professionals to find solutions for both their acute and chronic medical needs. We do this through primary care, telemedicine, concierge medicine, COVID-19 testing, as well as COVID-19 vaccines, and with my best-selling book, Vitality. So good afternoon, ladies and gentlemen. We apologize that we're a couple minutes late. Had a few technical issues. We had some technical issues the other day. We did a segment for you regarding the second dose of the COVID vaccination. And at the time that we did the broadcast, we had a little bit of trouble initially, thought we corrected it. And then when we went back, we actually saw that there was a little part of it that was cut off at the end. So we're going to resume a little of that, as well as to answer any questions that you have in regards to your COVID-19 vaccination status or getting it or whatever your questions are. The point of today's episode is to answer a lot of questions. There have been a few questions that I've had this week from patients, both at the vaccine site as well as in person for visits. And so we want to make sure that we touch and answer any questions that you guys have. We first started this, we did a segment with CBS 42 News. You know that we're doing segments with them, a segment called House Calls every Monday morning. I encourage you guys to tune in. We try to share with you guys some tips or helpful hints of advice that will help keep you and your family healthy. And so we'll be doing that every Monday at 6:30 a.m. at CBS 42 News. So please tune in. So one of the things we talked about was a vaccination checklist. Some of the things we want to make sure that you know to do and or not do. One of the things we talked about was not getting a COVID-19 vaccination at the same time that you're getting other vaccinations. Questions about this have been in regards to, oh, Dr. Celeste, what about the flu vaccine? Patients have asked about a shingles vaccine in combination with it. When should you get it? We want to make sure that you complete your vaccination series and wait at least 2 weeks before you get a different vaccine. We've also discussed with you guys waiting at least 4 weeks after your vaccine before you get a mammogram. So we definitely want you to stay up to date on all of your screening examinations, despite it being the COVID-19 pandemic right now. Most physicians have very safe measures. Every physician, let me say, not most, but every physician has very safe measures that they've undertaken to try and make sure that you getting that vaccination and or getting that mammogram will not cause you to be at increased risk. So definitely measures every physician office has taken at this time. So, but we want to make sure with the mammogram that you wait at least 4 weeks after your vaccination. Sometimes when you get the vaccine, sometimes not always, you can get a swelling in your lymph nodes. And you may ask why would we get that? Because the vaccine is communicating with your immune system, right? And one of the main organs of your immune system is your lymph node system, your lymphatic system. And so that's where a lot of work is done in relation to fighting off viruses, bacteria, etc., as well as them being the organs that help to keep us healthy. So having an inflammation or swelling in your lymph nodes is something that may happen, not alarming at all. It just means that your lymph node and your immune system is working. But we want to make sure that if you do have a lymph node swelling, that has gone away or dissipated before you go for that mammogram, so that we're not concerned that you could have an abnormal mammogram or abnormal lymph node after getting the COVID vaccine. So most routine medical procedures and surgeries, this is a second item we shared, most routine medical procedures and screenings can be performed before or after you're getting the vaccine. So things you don't have to worry about putting off. If you're scheduled for your colonoscopy, very important, screening for colon cancer, don't miss that. Stress tests, EKGs, ultrasounds, routine blood work, dental procedures, CAT scans, all of that is okay, plus or minus your vaccine, no matter when you got it. Third point that we made is we do recommend that you not pre-treat with ibuprofen, aspirin, or acetaminophen prior to your getting your vaccine. If you have to use that, utilize that afterwards. There's no issue with that, although we do recommend Tylenol instead of ibuprofen. For most medications, someone asked this question, hey, you know what? Do I need to stop taking my medicine before I come and get my COVID-19 vaccine? Most medications you do not need to stop taking. Again, check with your regular physician if you have questions about that, so that you can have that decision made prior to coming to the vaccine site. Okay? Okay. Now, Let's talk about interchanging the vaccines. This was a question that we had. We've had a lot of people that have come in and asked, hey, you know what? I had Moderna, but now I think I want to try Pfizer as a second dose. Is absolutely not recommended at this time to cross interchange the vaccines. That is something that may change in the future. We don't know at this time, but as it stands for right now, if you start with Moderna, we want you to get that second dose of Moderna. If you start with Pfizer Biotech, we want you to get that second dose of biotech. In addition to that, we want to make sure if you've received Johnson & Johnson that you're not trying to get Pfizer or Moderna at this time. At this time, it's not recommended by the CDC nor the FDA, okay? So we don't want to interchange those. So if you show up at our site, we are using Pfizer at our site, and you've been immunized with Moderna for your first dose, we will not immunize you with Pfizer for the second dose, okay? Okay, now let's talk about the second doses. This is something that's a little concerning. I know that we've been seeing, you all may or may not have seen reports in the news recently about the percentage of people that are not getting the second dose of the vaccination. When you get that first dose, and to be fully vaccinated, if you've received Moderna or if you've received Pfizer, you have to receive both doses of the vaccine to be considered fully vaccinated, and you're not fully vaccinated until 2 weeks after your second dose, okay? So we want to make sure that part is clear, because there are a lot of people that came in this week for second doses, and a lot of them said, oh, I'm good now, right? And you're not technically, they're good in the sense that they got the second dose, but they're not considered fully vaccinated until it's been 2 weeks after that second dose, okay? Now, there are a lot of people that are not, even in some studies that we've looked at and some of the reports that I've seen, some people are reporting about 8 to 10% of people aren't coming back for the second dose. Some people with reports as high as 14 to 20% not coming back for the second dose. And I caution you guys with this because to obtain full immunity to COVID-19, or to obtain the full benefit of the vaccination series that you're obtaining, you want to make sure you get the second dose. The first dose kind of primes we call it a primer, but it kind of primes your body, primes your immune system to say, okay, we're giving you this message and we want you to recognize the spike protein as COVID so that you can get rid of it, right? And it gives that code to your immune system and to the cells that help to fight off viruses and bacteria. It's giving that code to your immune system, right? So the second dose acts as a booster that helps to kind of boost your immune system. So you need both of those doses to be considered fully vaccinated. To only get one of the doses means you're getting some level of immunity with the first dose, but you're not getting the full benefit that vaccine has to offer with that second dose. And they can't guarantee the effective, that 95%, 94, 95% effective rate that Moderna and Pfizer have both studies have shown they're effective in. You're not achieving that when you don't have that second dose. So we definitely want to make sure that we get that second dose, okay? Now, do we have any questions? Hi, Ms. Golson. Thank you for joining us. Hi, Pretty Barbie. Thank you for joining us. I know that you recently made a decision. You put it on your social media to get your vaccine. And so congratulations on being fully vaccinated and helping to decrease the spread of COVID-19 in the community here in Jefferson County. Let's see. Hey, Ms. Shorts, how are you? Oh, she took her second dose on February 12th. Congratulations. Yay. You're fully vaccinated. I get excited when people get that second dose just because I know what it means for them in terms of being able to decrease the risk of spread of COVID-19 in our communities after seeing it ravish our communities over the last year. So this is one of the things, we have the same things in our arsenal that we're using: masking, social distancing, and hand hygiene. Things very important. Definitely want to keep those things in mind. And remember this, for those of you that are fully vaccinated, remember that when you go out and that you interchange and interact with others socially, just remember that persons that are not fully vaccinated are at increased risk of getting and spreading COVID-19 because they haven't been vaccinated. They are more of a risk than someone that is fully vaccinated. And for that reason, us continuing to mask and social distance and hand hygiene, with the exception, of course, if you're fully vaccinated. We can go over that here. When you're fully vaccinated, what does that mean? What does it mean in terms of socializing and what you can do and what you can't do? Okay, once you're fully vaccinated, that's 2 weeks after your second dose, or 2 to 3 weeks after that one dose of Johnson & Johnson, you can visit inside or a private setting without a mask with other fully vaccinated individuals. Very important, very much a sense of comfort with that. In addition to that, you can visit inside without a mask with a household of unvaccinated people from one household, though, that are not at risk for severe illness with COVID-19. You also can travel domestically without a pre or post test. So if you have to travel within the United States, you have your COVID-19 vaccination card, you can travel throughout the United States without having to get a COVID test before you travel or when you come back. You can also travel without quarantining after travel. Internationally, it depends on the location you're going. You do, when you come back, typically have to have a negative COVID test. But when you're traveling there, you need to just check to find out what are the requirements depending on where it is that you're going. So definitely be safe, have fun while you're there, but definitely still take your mask with you and your hand sanitizer, etc. Let's see, any other questions? Hey, Stacy, how are you? Happy Sunday. Oh, you're welcome. Oh, it was influential. Oh, yay. I'm so happy to hear that. That means that the work we're doing is helping. I'm happy that you're vaccinated. Very happy, and happy for you and your family that you're vaccinated. Does anyone have any questions? One of the questions that I got earlier this week was whether or not seeing some of the decrease in numbers in COVID-19 cases, whether or not that has been influenced by the number of people that are getting vaccinated. Absolutely, it has. We've seen a decrease in infections by as much as 21% in some areas across the country, which means there are a lot of communities that are getting closer to herd immunity. I definitely don't think that we're there. There are not enough people getting vaccinated right now in all across the state. You know, a lot of vaccination sites have seen decreases in their numbers going down. We definitely have seen that also at our location at the airport. But we will still be there vaccinating for the next 3 weeks at least. So if you're in need of vaccination or know someone that's in need of vaccination, definitely give us a call. It's a very simple process. I'll make sure that we post it on our social media so that you guys, if you want to make an appointment to get a vaccine, it was a drive-through location. You never leave your car. You literally drive up to the first registration tent. They check your ID, check your insurance if applicable, check you in, move you on to the next tent where you'll be vaccinated. They'll check your ID again. We do try to stay on top of that particular part of the process and making sure that we check your identification. Get that shot, and then it's a 15-minute wait. We have been averaging getting people in and out 23 to 28 minutes. 28 minutes typically is the longest that it takes to get someone in and out. We also are continuing to provide COVID-19 testing for those of you that may need testing. Our COVID-19 testing line is 205-543-2684 if anyone's in need of COVID testing. We are, Friday was our last day of providing testing at Legion Field, but our team will go on to provide COVID testing both for insured population as well as uninsured population at all of our locations. So definitely give us a call if you're in need of vaccinations or testing. Let's see, any questions? Let's see. Oh, she said I look like her aunt. Oh, you're so sweet. Okay, Miss Short, she said, I still wear my mask in public. I've been questioned by people knowing that my vaccination status on my reasoning behind that. Okay, so yeah, Miss Short, that's a very good, I'm so glad you brought that up because some people will ask that. When you're fully vaccinated, if you go inside and you're with a group of friends for lunch or dinner or what have you, and you're all fully vaccinated, yes, you can take off your mask. Some people do have the option of continuing to wear their mask if they feel, and there are a certain group of people I definitely think should be more vigilant than others when they go out to continue to wear a mask. Anyone with heart disease, anyone with asthma, anyone with autoimmune diseases. If you're in a group of people and you're unsure, either number one, unsure of their vaccination status, definitely still mask up. Or secondly, if you're an individual and you have one of those comorbidities and you're wanting to take extra precaution, wearing a mask is not it's not meant to be offensive to anyone. It's a protective measure. So definitely still do that if you, and some people will still do that if they are a spouse or a family member, have a household family member that has really critical heart disease or COPD or autoimmune diseases where they have weakened immune system. And if you're trying to take extra precaution because they're at home, you can do that. If you are with other individuals, you're fully vaccinated, so are they, and you all are inside and having dinner, you definitely can remove your mask. A small group of individuals where everyone is fully vaccinated and there's no issue with that, because it's you're considered to be fully vaccinated so that you can do that. But I definitely don't think it's to be frowned upon if someone does choose to continue to wear their mask. It's just a precaution. And just remember, the purpose of the mask is to prevent the spread of COVID-19, right? So the likelihood, if you're in a group of people that are fully vaccinated, that there will be a COVID-19 infection pass is very, very minimal. If someone wants to still take those protective measures, though, there's no problem with that. I think that's something that you have to kind of decide. You know, it's kind of like a personal decision. If you're fully vaccinated and you're having any kind of outdoor activities, you don't have to wear a mask. If you're alone or with immediate family members, you can gather, conduct activities outside without wearing a mask, except in certain crowded settings and venues. So if you are fully vaccinated and let's say you go into a venue and it's 500 people in an indoor building and you have no way of knowing what everyone's vaccine status is, I definitely would wear a mask in that situation. If you're outside and there are 500 people and you don't know their vaccination status, and depending on, whether you're closely interacting with other individuals, you may wear a mask. So I think that that's a protective measure. I still would avoid large indoor gatherings still, because, if you have a large indoor gathering, we do know that when you're inside around others, there's not room to have respiratory droplets kind of moving around as they are when you're outside, that it's an increased risk. So I think that's awesome that you're doing that and continuing to be protective of yourself and of your family. It's just a measure, an extra measure to protect yourself and your family. I don't think that you're doing something bad by continuing to wear a mask and you're fully vaccinated. I don't think that someone should look at that way. I think they should look at it as she's taking an extra precaution to protect her family. And there may be a lot of reasons why you're doing that, and that should be fine. I don't know why anyone would have issue with that. Let's see. Any other questions or issues? Any other questions or issues? Any other questions? Anyone have any other questions? So we will be, as I said before, continuing to do COVID testing. We'll be continuing to do COVID-19 vaccinations. We'll be doing that currently starting tomorrow from our site at the airport. If you are in need of primary care, definitely give us a call for that as well at 205-291-8842. If you're in need of COVID testing, give us a call at 205-543-2684. And if you're in need of a COVID-19 vaccination, definitely hop on our site and schedule an appointment. I hope that everyone has a great Sunday afternoon. And I hope that you guys continue to stay safe, be safe, and get the questions that you need answered. And just praying that our state remains healthy and continuing to see a decline in COVID-19 cases. So that's all we had to share from you. Again, I'm Dr. Celeste, your board-certified family medicine physician specializing in urgent care. If you're in need of any of these appointments, you can also visit our website at Dr. Celeste MD. That's DoctorCelestemD.com. Thanks so much, guys. Have a good Sunday. Bye.